Hello friends, today we are going to discuss about informed consent. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about consent, ethical and legal aspect of consent, various types of consent, what are the ingredients of this consent, challenges of this informed consent, how to enhance the administration of consent. In special population, how do you administer consent, and various specific procedures which are at high risk, how to take consent will be discussed in this video. Let's understand the meaning of consent. Consent means permission or agreement or approval. That is, permission for something to happen or agreement to do something, to agree to something, or give your permission for something. Basically, it's a permission that you're going to give. Let's understand the ethical and legal aspects of informed consent. From the bioethics perspective, autonomy is the basis of informed consent. You need to respect the autonomy of individuals. It includes truth-telling and confidentiality. Here, the important ingredient is autonomy. All persons have intrinsic and unconditional worth and therefore, should have the power to make rational decisions and moral choices, and each should be allowed to exercise his or her capacity for self-determination. That means autonomy plays a very crucial role, my dear friends. From the legal perspective, from the Constitution of India, the principle of autonomy is enshrined in Article 21 of the Indian Constitution, which says, right to life and liberty. Here, the expression of personal liberty under Article 21 is of widest amplitude and covers a wide variety of rights. It includes right to consent for treatment, right to refuse for treatment, right to live with dignity, right to die with dignity, and there goes a huge bunch of rights with regard to health, my dear friends, because right to life also has health as an important component. Let's understanding the consent from the general perspective. Section 13 of the Indian Contract Act of 1872, consent is defined as two or more persons are said to consent when they agree upon the same thing in the same sense. The breach of contract can have many repercussions. It can be civil or it can be criminal. The civil laws with regard to contracts may start with marriage, divorce, maintenance, adoption, guardianship, succession act, will, partition, religious issues, contract, endowment, and conversion. As per the criminal law, the best example I can give you is rape law, where anybody has an intercourse or sexual assault against the will of a person will be considered as a criminal act. However, the consent from healthcare perspective is very essential. Examination of a patient to diagnose, to treat, to operate on a patient without proper consent amounts to an assault in law, even if it is beneficial for that person, or even if it is done in good faith. The doctors may be charged of negligence if he fails to give the required information to the patient before obtaining his consent to a particular interventional procedure. This explains the role of valid consent, my dear friends, in health perspective. That means you need to take informed consent from your patient. There is a landmark case called as Clorendorff case in 1914. Here, Justice Benjamin Cardozo placed an important component which is quoted everywhere. That is, patient's right to self-determination. In his judgment, he said that every human being of adult years and sound mind has a right to determine what shall be done with his own body. And a surgeon who performs an operation without his patient's consent commits an assault for which he is liable in damages. This was in 1914, my dear friends. And Justice Benjamin Cardo's, whatever he quoted, is used still date, my dear friends. Let's understand the definition of informed consent. There are various definitions. It can be philosophical definition, ethical, legal. Here, I'll be quoting the legal definition of informed consent. In Mental Health Care Act of 2017, Section 2I defines informed consent. Here, the consent means giving consent for specific intervention without any force or coercion or undue influence, fraud, threat, mistake, or misrepresentation, and obtained after discussing to a person with adequate information, including risks and benefits and alternatives to the specific intervention in a language and a manner understood by the person. So this is the definition given in Mental Health Care Act, my dear friends. Let's look into the HIV and AIDS Prevention and Control Act of 2017. Here also, Section 2N defines informed consent. Informed consent means consent given by an individual or his representative specific to a proposed intervention without a coercion, undue influence, fraud, mistake, or misrepresentation, and such consent obtained after informing such an individual or his representative, as the case may be, such information as specified in the guidelines relating to the risks and benefits and alternatives to the proposed intervention in such language and in such manner as understood by the individual or his representative, as the case may be. This definition is wide. It includes the person who is undergoing treatment, and if he does not have capacity, it has given a scope for representative. That means he may be a nominated representative or a person who is in charge of that person, that is legal guardian, or even maybe a spouse. So this definition appears to be very comprehensive and apt to the Indian scenario, my dear friends. That means invariably when you are doing any kind of intervention, especially in India, maybe surgical procedure, any other procedure, it's not only the patient, the whole family members get involved in the procedure, and the decision taken will be by the family. It is a collective decision. And you have seen in many of the patients in India, it is the family who comes to help the patient. At the same time, they are the one who are going to take care of the patient in the hospital. Hence, for me, this legal consent given in Section 2N of HIV and AIDS Protection and Control Act of 2017 appears to be apt for our culture and also for our society. What happens if you treat without informed consent? If a medical practitioner attempts to treat a person without a valid consent, then he will be liable under both tort law and criminal law. Tort law is a civil wrong for which the aggrieved party may seek compensation from the wrongdoer, here the healthcare professionals. Similarly, the consequences would be the payment of compensation, that is in civil cases, or else imprisonment in criminal cases. If the complaint is given to the General Medical Council or the licensing authority, the doctor or the healthcare professional may lose license to practice also. A medical intervention without a valid informed consent is a criminal offense, and the physician can be charged with a battery based on the outcome of the Treatment without informed consent, it can be simple injury, grievous injury, death, and even if there is no injury, if you have treated a person without a consent, there can be charges can be framed because you have touched a person without his consent. Let's understand the type of consent. It can be two types: implied consent and expressed consent. Let's understand what is implied. The patient coming to the outpatient department, making the slip, or entering to the consultation chamber by his own will or violation may be considered as an implied consent. In such a scenario, you need not take a written consent. Most of the procedure in the OPDs invariably considered as implied consent. However, in specific interventions such as surgical or else injection, maybe in therapeutic condition, you may have to take expressed consent. It can be oral consent, that is, you have to explain the person and the person agrees for the examination. Handwritten consent. The patient will write that I have understood the information given by the doctor. These are the benefits, these are the risks, these are the alternatives which have been offered, and I have chosen this. And I agree to undergo the intervention written by the patient's own handwriting, or it may be the doctor's handwriting and signed by him. However, because of the lack of time, nowadays there is a pre-printed consent form that can be utilized. Nowadays, more advanced hospitals do take digital consent. That may be audio or video, or combination of audio video can be considered. So these are the various types of consent. Further, in the expressed informed consent, when expressed by the patient in writing, it is termed as informed expressed written consent or written informed consent. This is must in all surgeries, administration of anesthesia, and all complicated therapeutic and diagnostic procedures where the risks are very high. The person may even die or may develop disability or injuries. In such a scenario or intervention, you need to take written informed consent, my dear friends. Let's understand various stakeholders in consent. First and the foremost, the person who is administering the consent and the person who is receiving it. Sometimes the patient may be not in a proper state of mind, or may be unconscious, or he has developed mental incapacity. In such a scenario, the proxy consent or a nominated representative or even a legal guardian may give consent for the procedure. Sometimes we use supported and shared consent. Supported and shared consent means a person may not be able to comprehend the complicated medical terms, maybe even general language. In such a scenario, the healthcare provider, family members, and the patient together they sit and discuss, and the consent is given. Sometimes authorized consent will be given, that is mandated by the law. If a person has done something wrong, it may be a person who is accused of rape. In such a scenario, the court may force the person to undergo certain procedures. These are all called as authorized consent or by mandated by law. In many a time, the law itself also says in various legislation, you need to take consent or else the consent is implied by the process of law. Example is, whenever you do blood transfusion, you may have to do HIV testing of the donor. Here the law is authorized and you need not discuss with the donor at all. So such laws will be considered as mandated by law. Sometimes the healthcare provider, who is the healthcare provider? Is it the doctor nurse practitioner, or a counselor who is administering the consent, and finally, the witness. So these are the people who are involved or the stakeholders of consent in healthcare. Let me put it in a very simple words. One is the team of healthcare providers or a representative of a healthcare provider, patient or a patient representative, and the witness. So these are the three important stakeholders in informed consent. Let's understand what is the extent of the consent. That means if you take a consent, to what extent it is applicable, to what extent the healthcare provider can go once he receives the consent. First and the foremost, blanket consent. Here, during admission, the healthcare provider will provide a consent form which is blanket. I'll be discussing this in another video. Please do subscribe to my channel and look for this video. Sometimes duration based consent. Suppose a person is undergoing radiotherapy. It may be 15 to 22 one sittings. Should we take single consent so that repeated consent can be avoided, or else it is for a package of chemotherapy the consent is given? Suppose if he stops for 2 months and he comes back for the remaining radiotherapy or chemotherapy, should we take a fresh consent? That means some of the consent is valid for 2 months, 3 months, and you may have to repeat. Similarly, for electroconvulsive therapy, blood transfusion, especially in sickle cell anemia, thalassemia, is the consent is for lifelong, or else for every episode of blood transfusion do you need to take the consent? Many a time, considering the workload, the time required for consent, duration based consent is taken. Sometimes you may have to take extended consent. You may have to discuss with the patient who is suffering from severe abdominal pain, and you have to do laparotomy, and you may suspect 3 or 4 situations. It may be appendicitis, cholecystitis, or maybe something else. You may have to specifically discuss with the patient and say, if I see inflamed appendix, I will remove it, and the patient agrees for that. Or else you may also tell them, yes, along with appendicitis, there may be the inflammation of the gallbladder. I will take it out, and the patient agrees. That means during the procedure, before, when you're doing laparotomy, you can take extended consent and the patient need to agree for it. Sometimes it is also called as anticipatory consent, such as organ transplantation. Here, I can make a card in case of my death or else brain death. I wish to donate my organs. That is anticipatory consent. Procedure specific consent. This is the newest. You need to take consent very specific for the procedure. Either it may be diagnostic or therapeutic. Clinical research consent, diagnostic procedure consent, therapeutic procedure consent, and rehab consent. So the consent are various depending on the procedure, depending upon the timing, duration. The various consent are being taken. The consent will be limited to the time. It cannot be lifelong. Let's understand. The informed consent is a process. What do you mean by that? Informed consent is not merely a signature on the piece of paper, or it may be a form, but it is a process in which the patient has an understanding of the illness, has got the information regarding the illness, the procedure which has been offered to him, the risk and benefits of procedure, alternatives, risk and benefits, and finally he gives consent. That is the procedure, my dear friend. Just taking a signature on the piece of paper will not be considered as informed consent. Let me repeat it, my dear friends, for you. Informed consent is a process. You need to understand this. It's very important in the court of law. For example, to understand the informed consent, you need to go through this whole process. That is, introducing the diagnosis or possible diagnosis, differential diagnosis. What are the procedures you are planning? The alternatives for the procedure, benefit and risk, the question and answers asked by the patient, and the answers given by the doctor or by his team, time taken for the decision, people involved in decision making, what are the materials applied during the informed consent, what was the aid given to make him understand about the procedure, and finally, the communication of the decision. That means you need to understand very clearly. Majority of the legal litigation revolves around this process. The doctor or the healthcare provider invariably says, yes, I have taken informed consent. Look at this, here is the signature. Unfortunately, the whole procedure is not done. Hence, the informed consent becomes invalid, my dear friends. Here, you need to document what was the procedure adopted to share the information, the language in which the information was given, the patient's comprehending capability, his ability to weigh the risk and the benefits. People involved in decision making, especially in India, it is the family which takes the decision, although the signature is done by the patient or the patient's representative. It will be prudent to document who were involved in decision making, time taken to take the decision, and the communication of the final decision need to be recorded, my dear friends. And option to withdraw the consent is also offered, and it should occur before the procedure. And even the withdrawal of the consent can occur during the procedure. A right to refuse consent for a proposed treatment is there under our constitution, my dear friends. Let's understand the ingredient of informed consent. This is, if I consider as an informed consent, first and the foremost important thing, the huge responsibility casted upon the healthcare provider is to provide unbiased information with regard to diagnosis and the procedure or the intervention proposed. And the next very important thing is to know whether the patient is able to comprehend the information. And if he is finding it very difficult to comprehend, the healthcare provider needs to provide the information in a simple, general language or the language which the patient understands, digest the complicated information and make it very simpler to the person, and whether he is able to understand the diagnosis and the procedure offered. And once he has understood that, whether he is able to weigh the risks and benefit of the procedure offered, the alternatives given to him, and finally whether he is able to make the decision. And that decision should be free will, that is without coercion. These are the important elements of informed consent, my dear friend. That means informed consent is having adequate information, having mental capacity to decide whether to undergo or not, and the decision should be of free will. These are the three important elements of informed consent. Let's understand various ingredients of informed consent. All information should be explained, and the person who is receiving need to comprehend. And that should be in the non-medical terms if possible, and in the patient's own language is essential. What are those ingredients which need to be given during the informed consent? First and the foremost is the diagnosis. the treatment offered, what are the other alternative treatments available, the risk and benefits of each procedure, potential risks of the final procedure you're offering, relative chances of success or failure of the proposed treatment and alternative treatment should be discussed, my dear friends. Not only that, you need to document all this. You need to have question and answer session with the patient. What are the questions the patient asked and what answers were given? This is the ideal scenario, my dear friends. Because of lack of time, this may not be possible in India. The reason being is, if you discuss about surgery, the patient may ask maybe 30 to 40 questions, and the time taken for the informed consent may be 1 to 2 hours. And the 1 to 2 hours of the time of the surgeon need to be paid, because time is money, my dear friends. Hence, many a time, the administration of informed consent is cut short because we do not have the number of surgeons in the country, or maybe cardiothoracic surgeon, or maybe neurosurgeon. Hence, many a time, the informed consent may not be administered by the doctor himself. Maybe the representative of the doctor, maybe nurse or a nurse practitioner or a counselor may administer. But the responsibility is on the surgeon, my dear friends. However, there are some exceptions for the informed consent. Let's discuss about that. Patient prefers not to be informed. He says, I will become anxious. I do not want to know the whole procedure. My family member will decide about that. Please discuss with them. Many a time, the doctor or the physician may not disclose the complete information. That is therapeutic privilege. That is professional discretion is exercised not to give information. Imagine the patient has suffered myocardial infarction and is known to become very anxious. And if you give the information that you had myocardial infarction, he may become anxious. He may have a second myocardial infarction. In such a scenario, the doctor will say to the patient, nothing has gone wrong. He may discuss the information with the family members of the patient, telling that he has got the cardiac attack. Hence, sometimes in some countries, the privilege communication is preferred. So the patient is not put to agony. In emergency situation, you do not have time to take informed consent. Patient may be unconscious. Patient may be comatose. Patient is in altered sensorium. In such a scenario, you do not have time. In that situation, you need to save the life. By the virtue of the Constitution of India, Article 21 talks about right to life and liberty. Here, the right to life takes precedence over liberty. You have to save life. Hence, the doctors have been given an enormous power to save him without consent. In another scenario, an incompetent patient, a person with severe mental illness who is unable to comprehend, or maybe is in a catatonia, a person who is having intellectual disability, that is IQ is very less, a person with a loss of capacity, that is dementia. In children, the informed consent is not taken from the patient directly. Invariably, either the legal guardians or the legal representatives will give the consent, my dear friends. Only in the emergency situation, if nobody is available, the informed consent cannot be taken, and the legal waiver of is given. In most of the situation, you need to take proxy consent from the family members. Let's understand how to administer this consent. Informed consent does not just take place on paper, just by one signature. It is a process occurring over a period of time. Anyone taking a signature and collects the form does not mean He has administered informed consent. He has done the procedure only. The physician who is in charge of the patient care, they are the one who are ultimately responsible for the administration of informed consent, explaining the procedure, and they are legally liable. Responsibility of administering consent is on the physician. However, he can delegate this responsibility to his junior, to maybe a nurse, to maybe even a cured patient who is educated, who wants to administer the consent by giving the positive and negative aspects, risk and benefits. So, in such a scenario, that also can become a valid consent. That means representative of the treating team. So, again, I'm repeating, consent is not just taking a signature of the patient. It is providing information, proposing treatment, what are the alternatives, risk and benefits, and the impact of the treatment. And finally, the course and outcome. Those need to be discussed with the patient, my dear friends. The whole thing revolves around the documentation of the consent, my dear friends. The documentation starts with the discussion of diagnosis. Hence, put the date and time. Today I revealed the diagnosis to the patient. These were the family members were available and the diagnosis was explained. And the possible treatment was discussed today. And following investigations were requested. The patient and family members left today. Some informations were given, such as book, brochure, videos, YouTube videos, booklets, animations, and some models were shown how the procedure is done. The patient family members does the investigation and they come back after 1 week. The questions are asked again. Who are the people involved in the decision making? And finally, the decision is communicated by the patient or by the family members, whether the patient agrees with that, and documenting the whole process, starting from the consultation to the end, that needs to be documented. Just taking a signature on the consent form is not valid, my dear friends. It is the whole process of disclosing the diagnosis, proposing the intervention, discussing about alternatives, giving time to take decision, number of people involved in decision, and the people involved in making decision, and final communication. Let's understand about the signature of the witness. Is it required? Of course, it is required in the court of law. Many times, the signature of the witness is the family members, or it may be the staff of the hospital. From the legal point of view, please avoid the hospital staff signature. It should be an unrelated person. That is, another patient's family member can be the witness. However, in India, the role of witness is not clear. Here, the witness should be there from the disclosure of diagnosis, alternative interventions given, proposed intervention, risk and benefits, time taken, and again the witness comes back and finally he signs. What is the issue of confidentiality here? Or else, is it just a ritual? The patient signed and I saw that, the patient signing it. Or the whole proper information procedure is completed, whether he was the witness for it. Breach of confidentiality and stigma related to the illness, the patient may refuse to have a witness. So these are the unanswered question which is there, and they may raise bioethical issue here. Invariably nowadays, the witness are called only during the signature procedure. This need to be debated because the witness is not for just the signature. He is a witness for the whole process, my dear friends. Let's look at what are the components of valid consent. Valid consent means providing adequate information information regarding the assessment and diagnosis, the proposed treatment alternatives, risk versus benefit, consequences of no treatment, and the course and outcome. Whether the patient has mental capacity to understand all this information, weigh the risk, retain some of the information given, and communicate his decision. And finally, the decision is free will. That is, there is no coercion in his decision. It is a voluntary decision. No misrepresentation of the facts was done. Then only it will become valid consent, my dear friend. Valid consent means in the court of law, the whole process need to be completed. Then only it will be considered as valid consent, my dear friends. What is invalid consent? If the consent is given under fear, misconception of fact, or misrepresentation of the fact, coercion, consent taken by from an intoxicated patient, patient who is disoriented, who is delirious, who is unconscious, patient who does not have mental capacity, person with unsoundness of mind, or a person below the age of 18 years. Those consents will be considered as invalid, my dear friends. So in such a scenario, there is something called as proxy consent or surrogate consent. Invariably, in countries like India, the proxy consent is considered valid. However, in Western country, it will be considered as supported decision making. Although the patient may not be in a position to understand the whole thing, the healthcare provider and the family member will support the patient to take decision. Will it be considered as a coercion? That needs to be debated. Proxy consent or surrogate consent can be taken during emergency situation. Patient is unconscious, the family member will give consent. Or else, in a hospital, the medical superintendent can give a consent. Advance directive. That means the person has written a will telling that if I become vegetative state or unconscious, or if there is incapacity, then so and so person will take decision on my behalf. And for children, the parents will be considered as proxy or a surrogate decision maker. Family members will be considered for a surrogate decision making with regard to persons with mental illness and intellectual disability. Although in an ideal world, the informed consent should be taken from the patient, but the patient's not can be idle is very difficult because of their illness, their comprehending capacity, their decision making capacity, their communication ability may be altered. That is the reason the proxy consent or surrogate consent still exists, my dear friend. However, there are people who debate, no, it has to be supported decision. Of course, I do respect that thought, but do we have so much of resources, so much of doctors, surgeons? They can sit with the patient and discuss. The question arises here whether the patient can afford for that much of time in terms of money, my dear friends. Hence, nowadays, the proxy consent or surrogate consent is slowly getting replaced in developed world. They are replaced by supported and shared decision making. Invariably, in a country like India, it is a shared decision making. It is a family members get involved in decision making. Hence, whenever you take informed consent in India, please do involve family members. It's very prudent because it is the family members who are concerned about this person. They are the one who are providing the economical support to the patient. The state providing the complete health care is very, very minimal. It is the family members who are there for the patient. Hence, involving them in a decision making is very essential. And the treating team, the representative of the treating team should be available for decision making, and taking the signature. Let's understand what are the challenges with regard to informed consent. There are three important challenges which I would like to divide: the challenges from the treating team, challenges from the patient side, and the challenges with regard to informed consent or the social challenges. Let's look at it from the treating team. Many a time, the poor communication by the surgeon or by his treating team, lack of time for the informed consent. The treating team does not have time to discuss this. Since there is no monetization for the time given to the patient, that means if the treating team spends 1 hour discussing about the proposed procedure, discussing about the alternatives, giving all informations, showing videos, and finally taking decision, it may take 1 hour to 2 hours. Whether it is monetized, because the surgery may take 30 minutes, and if the informed consent takes 2 to 3 hours, who will pay for it? Whether the insurance company will it take responsibility for administering the informed consent? That is, the monetization of the informed consent has not occurred till date. The reason is time is money, my dear friend. And many a time, the healthcare professional at times feel that they are not responsible for informed consent. Many a time, the procedure done is involving multidisciplinary team. Imagine there is an accident. One need to reconstruct the arteries. That means vascular surgeon is involved. The bones are broken. Orthopedician is involved. Plastic surgeon who is going to take care of the looks. Anesthetist. And finally, cardiologist who has given opinion that this person is fit to surgery. That means in a multidisciplinary team, who will be held responsible? Is it the surgeon alone? Or else the informed consent not taken by the cardiothoracic surgeon or maybe the plastic surgeon, will he be held responsible or not? Hence, my dear friend, in a multidisciplinary team, it will be very difficult. Many a time, these people, all of them would have discussed, but the documentation would have not occurred. That poor documentation comes in the way. Not being able to anticipate various interventional procedure. You are doing a surgery and you see there is another abnormality, and you need to anticipate such things, and you need to discuss these things with the patient. Without discussing with the patient, do not do any extended procedure. Any extended procedure will be considered as violation of informed consent. And of course, the paternalistic attitude of the healthcare provider is another biggest challenge. Let's understand from the patient perspective. Anxiety, fear regarding the procedure, poor health condition of the patient. He is already drowsy because of the various medication. His mental capacity is not up to the top notch because of his metabolic parameters. He is on medications. He may have mental incapacity to take decision. Illiteracy, medical jargons used by the doctors and the healthcare provider. Many a time, many family members are involved in decision making. And of course, hospital bill, the cost. If I ask questions, what will the healthcare provider or the surgeon will think? Mistrust, language barrier is another important challenge we need to address. Finally, the consent document, whether we are using complex medical terminology, foreign language, English language, many pages, how much should be disclosed? Should be 100% or it should be reasonable information, blanket, pre-printed consent form, witness, legal document. In such a scenario, all these issues becomes a challenge, my dear friends, because majority of the cases revolve around informed consent. Now the question is, how to enhance the informed consent? Let's discuss about various strategies can be adopted. The informed consent should be simplified, and it should be in a simple lay terms language. It should be in patient's language. Provide adequate information in the form of brochure, information booklet, videos, presentation, charts, multimedia demonstration. You may also use patient champions. That means the old recovered patients, they can administer informed consent. Mental capacity assessment is to be done. Imagine if a person has mental illness, you need to do mental capacity assessment before you take informed consent. You may hire doctors to administer informed consent. Maybe nurse practitioner, maybe counselor can be hired because surgeon is busy. He may not have time. His representative can administer the informed consent. Let him take through the patient with the whole process. And of course, monetization of the informed consent is required at this point of time. As I mentioned, the time is money. The more the time is spent with the patient, that needs to be charged. Then, none of the doctors will not move away from the patient. They would like to spend as much of time with the patient so that there will be no legal issues later. Insurance companies need to accept this because invariably nowadays insurance company gives package. This is the package for such a surgery. This is the package for chemotherapy, radiotherapy. This package is coming in the way. In some surgery, the patient is very clear, no comorbidities, and anatomy of the person is normal. In such a surgery, the package may work well. If the patient has comorbidities, he has anatomical anomalies, again the same amount. Sometimes, because of the old age, because of other complications, the surgery may take 5 to 6 hours. In certain cases, it may be just a 30-minute. Again, the package comes in the way. The package says, oh, this is the package we are going to give. It is not based upon the time spent with the patient, my dear friend. And of course, we need to make sure this insurance company pay for the patient's premium what he has paid. Intervention specific concern need to be taken. It should not be just a blanket consent. And these specific based intervention consent should be prepared by the national professional bodies, which is approved by most of the professionals in that field. That standard uniform consent should be available. The process needs to be streamlined and that needs to be administered. Of course, video recording of the consent can give legal protection to the patient and also to the physician. And you need to document the questions posted to the patient by the patient and the answer given. It is prudent to involve family members in India. Again, you need to discuss with the patient that we are going to discuss with your family members and you need to give consent to involve them. Involving the family physician, that is patient's doctor, need to be involved. Give time for decision making because it is a process. It is not a one-time cross-sectional. It is a process where the elective surgery may take 1 week or 2 weeks. That is the process which needs to be captured and documented in the medical record. What are the helps given to the patient to understand the procedure? Now, over a period of time, involving ChatGPT, artificial intelligence, video recording of the consent, showing videos, enabling the patient and empowering him to take decision making. And of course, if the patient is able to write advance directive, then these becomes a valid consent, my dear friends, in the court of law. Let's understand consent in special population. Consent with regard to children, adolescent, the assent need to be taken. These are essential in Western country. In India, if a legal guardian gives the consent, that becomes accepted in the court of law. In a pregnant woman, should we take consent even from the husband? Of course, with regard to medical termination of pregnancy, it is an ethical issue. But with regard to legal, the pregnant woman, consent is more than enough. We need not take her partner or her spouse or the husband consent. If a person has intellectual disability, in such a scenario, legal guardian should be the decision maker. If a person is in coma or persistent vegetable state, whether he has advance directive or the legal guardian will take the decision. Again, with person with severe mental illness, person with severe disability, that is intellectual disability, and persons with dementia, these are the people who have difficulty in comprehending, understanding the information, weighing the risk and communicating. In such a scenario, the doctors need to take consent from the legal guardians. Let's understand consent in special procedures. If you are doing clinical research, if you are doing investigational new drug trial, that means the new drug which never been used for anything else, you are trying it first time, the risk is very high. That means there should be 100% compliance with regard to consent. With regard to various surgery, organ transplantation from a living person, from cadaver, of course, with regard to living donor, there are rules with regard to organ transplantation. In such a scenario, they are requesting for video consent. With regard to surrogacy, with regard to artificial reproductive transplantation, with regard to sperm and oocyte, medical termination of pregnancy, chemotherapy, radiotherapy, these are the various procedures. You need to be very clear and a specific procedure consent to be taken. You need to take consent from the legal guardian if they are incapacity. And you need to understand the rule of thumb. More the risk involved in the procedure, rigorous should be the informed consent. That means, based upon the procedure, you need to use your common sense to administer informed consent thoroughly. To conclude, my dear friends, the patient has a legal right to autonomy and self-determination, which is enshrined in the Article 21 of Constitution of India, that is right to life and liberty. The consent obtained should be legally valid. Law presumes the doctor to be in a dominating position in the fiduciary relationship. Hence, the consent should be obtained after providing all the information to the patient. A doctor who treats without a valid consent will be liable under the tort and criminal law. Providing information regarding the risk is based upon the procedure involved. Higher the risk, then the informed consent should be rigorous, my dear friend. Informed consent is not mere at taking a signature on the form. It is a process. The process of providing information with regard to diagnosis, proposed treatment, what are the alternatives, the risk and benefit of these procedures. If they refuse treatment, what are the course and outcome, documentation, time given for making this decision, what are the questions asked by the patient, answer given by the doctor, and finally, the communication of the decision. And India, please document who are the people involved in decision making. That is the family members and the family physician if they are involved. Please do document and take their signature. Then that informed consent becomes valid, my dear friends. Thank you very much for your valuable time.